Good morning, everyone. I am back out at Academic Alliance in Dermatology, where we are telling you about a special event coming up that they are hosting that this man right here, Dr. V, is very passionate about. This is something that we have talked with you a lot about because I know your passion, your mission with this team is letting people know about melanoma and letting people know that this is something that we can actually prevent with good screenings, which brings us to this event coming up on May 4th. Good morning. How are you?
It's so easy for me to talk about melanoma because I'm very, very passionate about that. That's where I selected to make a difference. I just want to cement my legacy and the legacy of our organization by making a difference in melanoma by promoting early detection.
So early detection is key. And this is what you're doing for this event on May 4th.
Absolutely.
In the morning hours of Saturday, you're inviting everybody to come out and you will be doing these screenings for free.
I will be there with all my assistants, helpers, team, doctors. We are committed to make this an impactful event, make a difference. People understand that a 2 millimeter small, tiny dot can kill when it spreads, but is curable and 100% preventable. The death from metastatic melanoma is preventable with early diagnosis, and that's what we are promoting. And the early diagnosis comes with education and community work, and that's what we do today.
Well, and let's talk about maybe who should be coming out to this event. Are we talking about all ages? Is there certain ethnicities that are more at risk? I mean, what is it? Who are you wanting to see and really help and get the word out?
I invite everybody. I invite everybody, every age, every race, every ethnicity. That's the way I work. You can never start education early enough. We can start education very, very early with the children. Now, when we're talking about type of skin that is higher at risk, is more or less we designate that as type 1 and 2. That is more or less the red hair, light color, blonde hair, light color. When we go to type 3 and 4, which is rather Mediterranean and darker skin, the risk is lower, but it's still there. Something that is really recognizable more and more with time is that certain genetic traits, they can be obscure for one generation and then appear in the next generation. I had recently a patient, I look at him, the mom was Filipino, the father was Greek, and the child was red hair.
Oh, wow.
I had to ask to recognize that really the great-grandmother was German red hair. So, just like the color of the hair, the color of the skin can be obscure. There are genetic traits that they are expressed on the skin and they are relevant to early detection of melanoma that we got to recognize early and educate our people early. The family history is really the key when it comes to preventing metastatic melanoma.
Before we wrap up, is there anything that you want people to know as far as red flags that if you see something on your skin that either looks a different color, a certain size or something that, you know, this is really the time you need to get that looked at now?
There are melanomas that they read the books, and there are melanomas that I have seen in life, and they surprise me. I have seen 7,000 cases of melanoma. We have a gallery on our website. There's all type, garden variety of lesions. When you have a doubt about any lesion, let us check it. Because I have seen melanoma that they are red, that they are skin color, that they are black, that they are brown. None is standard. Is not a cookie cutting process. The variability of melanoma impresses me and surprises me every day.
Well, again, this is why we are so thankful you and your team are doing this event. We're going to make sure and put all the details on our website as well. But again, it's going to be May 4th from 9 to 11. It's going to be one location. We'll make sure and put that address up on the screen as well. Thank you so much for all you're doing for the community. I know this is going to be, potentially life-saving for some people as well. So we appreciate it.
It is. We find about 4 to 5 melanomas every day And we have an amazing track record. And it's so easy to talk about melanoma, early diagnosis and detection and prevention of metastases when you speak from the heart.
Yeah, that's what you do. Thank you, Dr. V.
Thank you so much.
Of course, go to our website for more.